colleagues from the media, and it's always a pleasure to have this conversation with you all on Thursday at 11 a.m. My apology for the slight delay. I was still caught up in another meeting. First of all, let me appreciate your continuous support and cooperation in the fight against COVID-19. We are living in an extraordinarily difficult and challenging time, dealing with a virus that is spreading very rapidly, very quickly, very aggressively. And I would like to, first of all, acknowledge the remarkable efforts of the healthcare workers and volunteers that are providing frontline services to address this challenging situation. In terms of the epidemiological outlook of this virus, as of 9 a.m. East African time today, the global number of cases has risen to over 4.1 million people in over 200 countries and territories in the world, with over 300,000 deaths, very, very unfortunately so. In Africa, we now have 54 countries that are reporting a total of 72,336 cases, and of that number, 2,475 deaths have occurred, leading to a case fatality rate of 3.4%. The good news is that there have been 25,268 recoveries from those infected. Since the last time we had a briefing on May 7 until the 13th of May, 20,494 new cases, I repeat, new cases have been reported compared to 14,896 that occurred the week before, that is the week between April 30th and May 6th. This is about 1.4 times more cases reported this week, with an average of about 3,000 new cases reported per day. This week, the West African region accounted for 33%, or 6,839 new cases, followed by the North Africa region, which represented 25%, or 5,200 cases, followed by the Southern African region, that reported 23% of the cases, which is equivalent to 4,696 cases. And then the East African region reported 10% of the total cases, which represent about 2,000 cases. And lastly, the Central African region with 9%, representing 1,752 cases. The 5 countries with the highest cumulative number of cases include South Africa, reporting 12,000 cases, Egypt, 10,000 cases, Morocco, 6,500 cases, Algeria, 6,200 cases, and Ghana, 5,400 cases. The 5 countries that I just indicated account for 56% of all cases reported in Africa. Countries reporting the highest number of cases per 100,000 population include Djibouti, Sao Tome and Principe, Cape Verde, Gabon, and Guinea-Bissau. So if you take those numbers and you square them by 100,000 population, that is what we see. Sahara Democratic Republic is the only African country, as we speak today, without a case, because Lesotho reported their first case yesterday. So in other words, we now have 54 of the 55 member states reporting at least a case of the COVID-19. We always, as usual, encourage you to go to our website, which is Africa's CDC, oneword.org, to update yourself all the time on the situation, the evolving situation of COVID. Let me now transition to what Africa CDC is doing in terms of deployment of responders to support member states. Since the beginning of this pandemic, Africa CDC has deployed over 148 volunteers to support response in different countries. Since the beginning of May, which is just about 2 weeks ago, we have deployed 10 additional volunteers in the Democratic Republic of Congo, 20 in Ethiopia, and 15 in Nigeria. Additionally, 63 are being deployed in Burkina Faso, Cameroon, Ghana, Mali, Niger, Tanzania, Zimbabwe, and Zambia. There are other requests for deployments in Sierra Leone, Sudan, and Chad, and we will continue to support them, this deployment, as part of scaling up the initiative we launched, which we announced with you a few weeks ago, called the Partnership to Accelerate COVID Testing, in abbreviation, PAC. Again, PAC is an important initiative that is underpinned by the ability to track, test, trace, and treat individuals. I think that is the formula and strategy that we are pushing forward across the continent massively. In terms of training and knowledge exchange, in the past week, Africa CDC, as I've heard, held the 9th weekly seminar on clinical community of practice, involving 312 active participants to discuss current treatment approaches to COVID-19. We also held a special webinar involving 32 member states with Chinese experts to discuss case management of COVID-19 patients in Wuhan and traditional Chinese medicine as an alternative treatment for COVID-19. We also conducted 2 webinars involving 250 experts from 40 member states on leveraging severe acute respiratory infections and influenza-like illnesses surveillance framework for COVID pandemic response. The Africa CDC has launched an online rumor tracking system to monitor rumors and misinformation about COVID in Africa. This will track rumors and misinformation across the continent, so that as we continue to move forward, we understand exactly how to fight misinformation and ensure that we provide accurate information as much as possible with your, of course, your close collaboration. So let me end here and turn it back to Wayne.
Thank you very much, John. It's time now for us to go into our questions, and we will move straight on to a question. I have the first question that came through from Cristina Ferreira, and she's with the Portuguese news agency Lusa. The number of cases in West Africa has increased by 34% compared to the last briefing. What is your assessment of the evolution of the pandemic in that region? This is point A. The second one is, what are your main concerns and what warnings for that region? And then finally from Christina, how do you feel about the growing number of countries that are easing lockdowns?
So, first of all, we have, as we reported, or in my introductory remarks, I did mention that overall, compared to last week, we have, for this week, beginning May 7 to May 13, 20,400 new cases there. And the West Africa region continues to be seen a lot of new cases there. And there are 3 countries that are driving this number in West Africa. One is Nigeria, Ghana, Cote d'Ivoire, actually 4 countries, Cote d'Ivoire and Senegal. Those are countries that we continue to see the large increases there. Now, we also need to know that these countries, Ghana, Nigeria, and Senegal, are ramping up their testing significantly. For example, as of yesterday, Nigeria had tested about 30,000 people. If you compare that with just a few weeks ago, where the number was less than even 10,000, I think that is a remarkable progress in the right direction. The They set themselves a target of testing 3,500 people a day. They are currently testing about 2,000. That is a great, remarkable progress. Nigeria has also established about 24 testing sites. I mean, up from just when we started, there were just about a few labs in Abuja and Lagos doing the testing. So the point I'm making is that the more you scale up your testing, the more you find new cases there. And at times it's not a bad thing, it's a good thing, which means that you are sizing the burden of the disease, you are tracking where the virus is, and you are doing the basic things that we have all recommended, which is to test, isolate, track the contacts there. So a increase in number backed by a strong testing is okay, because it tells us that you are expanding your testing, and then you are deploying your public health measures as much as possible. So we continue to encourage countries that we should adhere by the PAC strategy, again, which is the partnership to accelerate COVID testing, so that that is the only winning formula that we have at this point. So we'll continue to watch the region as the cases evolve and begin to see when they will plateau, and then begin to observe the declines.
Thank you for that. The next question that we have is coming from Cara Ann, and she's with Associated Press. The first part of her question is shared with Robbie of AFP, and that question is, what is your reaction to Burundi kicking out the WHO country representative and 3 experts? Then Cara has a second question. Also, have any significant new sources emerged for testing kits or other critical medical equipment for African countries?
So, with respect to the Burundi situation, I think I'll characterize it as unfortunate. This is the time where we need greater cooperation, greater coordination with everybody, including the political leadership of each member state, including the cooperation with the public health experts all over, including cooperation with the community. This war has to be won in a coordinated fashion, and cooperation is key and central to this fight. We are in dire needs of technical expertise as a continent, which has very weak health systems and fragile infrastructures, where we don't have the luxury of kicking out WHO, a strong technical partner in a country, in member states. So I think we will continue to encourage countries to do the right thing, which is if there's any differences, I think it deserves that there should be a dialogue and effective communication to resolve it, rather than take measures that would disrupt the ability to effectively respond. We feel very strongly about this because a COVID infection in any member state, in any of the 55 member states, is a COVID infection in all 55 member states. As we strive to integrate the continent, we cannot live in isolation. I mean, these victories, individual victories will occur, but the continental victory is what is going to matter so much to all of us. The second part of that question dealt with the testing. Yes. I mean, as we speak, there are 4 countries that have, in Africa that have started developing diagnostic tests. That is Senegal, Morocco, Kenya, and South Africa, to the best of our knowledge. And we are in active engagement with all 4 countries to understand what the test is, support them in the evaluation in a rapid manner, so that we can begin to use those tests on the continent. And we remain very hopeful that in the coming weeks, some of these tests will be validated in terms of their performance, and then if they are shown to be reliable, that is in terms of the sensitivity and specificities, then there will be absolutely be no doubt that we will work with them to scale the production up and use on our continent.
The next question is also a shared one between Robbie and Julia of Reuters. And that question is about the holding of elections in Burundi next week. So Robbie says, what are the risks of holding elections in Burundi next week? And Julia says, what do you think about Burundi holding these election rallies?
If I'm not an election specialist, so I don't know how elections are conducted at each country level, but we should maintain some core principles that we have to collectively deny the virus any space to transmit, which means that if you bring people into settings where there's a lot of interaction and people don't respect the physical distancing, then you facilitate the transmission of the virus. I mean, that is clear. It's not, it's basic understanding of what we mean by deny the virus the ability to transmit. And we have to always balance between the danger and the threat that this virus poses on our national security and the drive to go ahead and conduct elections, which may end up making it extremely difficult for the country to overcome the challenges of the spread of the virus. We've seen that in countries where they've gone ahead and conducted elections, or where they've enabled people to come together in a political rally, the cases have increased. I mean, there's absolutely no doubt about that. So if the elections were to be conducted in a manner that will limit the space for people to come together and cluster so much, then it's okay. But if we cannot ensure that people can either vote online from their homes or ensure long physical distancing, then it only puts you at danger that you will spread COVID-19 extensively after the elections or the rally, especially the political rallies.
All right. Julia has another question, and she wants to know if there are any countries where we have difficulty getting data. She says you don't necessarily need to mention the names, but do we have this situation?
We clearly have or encourage all countries to share data. Data is the ingredient that allows us as a public health agency of the continent, mandated by the head of state, to wage a spirited fight against the COVID-19. Without accurate data from all member states, it becomes difficult. And let me again state that no country is an island in this. The virus doesn't carry passports, so it's not like country X can deny access or ability to share its data, and then if you feel safe there, you just create insecurity to other countries. We are only as strong as the weakest link, so we encourage all countries to share data in a timely fashion with Africa's CDC as mandated in its statute, which is approved by the head of state. So we will continue to reach out to countries and say that two things we are looking for data is the speed of sharing the data and the quality of the data.
All right. I have a question here. Is the Africa CDC doing anything to encourage Tanzania to declare the number of cases, seeing that it also affects the SADC and EAC countries?
We strongly call on Tanzania and encourage Tanzania to share data in a timely fashion with the Africa CDC, with the World Health Organization, so that we can understand what is going on in there and then look at ways to develop that appropriate partnership and collaboration and to provide them with the technical advice and technical assistance that is required. This is a pandemic of an unprecedented level on the entire continent and the whole world. As I stated earlier on, the continent has, as a whole, has reported about 72,000 cases, and it is only increasing. So it is for the interest of Tanzania to share the data in a timely fashion, and that so that we understand exactly where the gaps are, and then support them accordingly.
Joa from the German press agency. Even though some African countries have ramped up testing, it is still far below countries in other parts of the world and also where it should be. Why are countries testing such few cases in Africa? Is it the lack of testing kits, lack of capacity, or something else? And how can these issues be dealt with?
That's a very good question. I think we should be looking at the trajectory where the continent is heading. When we started having these conversations several weeks ago, the testing level was extremely low on the continent. Today, I can share some numbers with you. As a continent, we've tested close to 1.2 million people or conducted 1.2 million tests. If you compare that with just 4 weeks ago, when we launched the PAC initiative, the continent as a whole had tested just about 415,000 people or tests have been conducted. So from just 4 weeks ago to where we are today with 1.2 million, it shows that the testing is in the right direction. I use the case of Nigeria to illustrate how quickly the testing has been ramped up. We still have an issue of access to tests, but the problem is getting better. And it's in the right direction. So I think we should acknowledge that there's been a global shortage of tests and test kits, which Africa CDC is working to unlock the situation. We did announce during the last 2 weeks, or actually 3 weeks ago, that we were launching the PAC initiative and to increase the distribution of tests by 1 million in the next couple of weeks. And I think we are proud to say that we are on target to meeting that. We have distributed more than 250 tests out of a depot in Senegal. This week we'll be distributing another 500,000 thanks to the Jagma Foundation. That brings it up to about 750 tests just in a couple of short 3 weeks or so. So I think we have to be, I applaud the efforts of countries in the ability to scale up testing under very challenging circumstances there.
I just want to remind our audiences, fellow journalists out there, that if you have a question that you want to put forward to the director of the Africa CDC, you can use either Blue Jeans or WhatsApp. And the Blue Jeans details are that you should enter your name and the organization that you're representing in the chat column on the Blue Jeans platform. If you prefer to use the WhatsApp, you can send your questions to +251 945 502 310. Moving on, we have a question from Dingy, and the question is, Madagascar's herbal medicine, how far are we in terms of scientific testing? Is the scientific testing encouraged since it is an African initiative?
Yeah, thank you for that very important question. We are in discussions, and actually active discussions with the government of Madagascar. We wrote to the ministry, the government of Madagascar, and just yesterday or the day before, we received an official response from the government of Madagascar stating that they were very, very willing to work with Africa CDC to understand what this remedy is about. And so we are excited with that. We have absolutely no doubt that Madagascar has very competent scientists and public health experts, and I think we want to believe that they will come forward with the findings that they've had so far and share that with us. We've also invited them, the scientists from Madagascar, to join the task force, the Continental Task Force for COVID response, and I'm very sure and optimistic that they will join, and also through that media share the results they've seen so far with us, and we'll collectively look at the data that exists in two ways. We'll look at the data related to safety, That is, are there any side effects when people take these drugs or this remedy? And then secondly, we look at efficacy data. I mean, how effective is this? And then we jointly with the active collaboration of Madagascar scientists and public health experts make a determination if we will need to expand that study to other countries and collect information on safety and efficacy, or if the results that they have are valid. So we are approaching this with a totally open mind, and it will be our pride that a solution against this war, which is the COVID-19, comes from an African country, and we just don't know where the solutions will come from, so we cannot reject anything or roll in anything, but all we say is that we should be methodic and systematic in our approach to validating any remedy that is pronounced.
My brother Peter Fabricius from the Daily Maverick has been on standby for a while. Peter, can we come to you for your question? Okay, we can hear you now. Please, yes, we can hear you now. Please continue.
Yeah, Dr. John, I have two questions, if I may. The one question is, have you reached the point where you can validate any sort of ventilators that have been made in the country? In Senegal, we know, we've seen quite a lot of the media are experimenting with a rather cheap form of a ventilator, but I got the impression that it's not yet ready for use. And then the other question is, are you confident that if someone discovers a vaccine outside of Africa, let's say, Europe, America, that it will be rolled out to Africa at the same time as rolled out to Europe and America? Or do you believe that countries will take a rather sort of selfish nationalist view and vaccinate their whole populations before they vaccinate the most critically vulnerable people in Africa, for example?
So thank you so much for that very important question. With respect to the ventilator piece, we've actually, as you probably know, we have a separate working group under the task force, the Continental Task Force, that is focused uniquely on science research and regulation. Okay, science research, regulation, and standards. So that group essentially pulls experts across the continent, and this expert group will be very open to working with any local manufacturer, not just for ventilators, but any other products that are out there that require that we have a continental opinion on it. So we are actively engaging with not just those in Senegal, but there are also manufacturers across, including my colleague Dr. Taj has been in contact with colleagues from Ghana to understand the manufacturing of ventilators that is ongoing, and other countries. So I think we stand by to look at that critically, to again, in the spirit of what I just described for the remedy in Madagascar, is to make sure that it's safe for the people. You cannot, we have to ensure that the product that we recommend for the patient is safe and effective, whether it's a drug or a ventilator or anything else. With respect to vaccines, I think I'm very pleased that there's a global voice out there that is calling for immediate access and equity to vaccines when they become available. I myself am on the board of the Coalition for Epidemic Preparedness Innovation, in abbreviation CEPI, and I sit on the subcommittee of access, which is, I think, our voice as a continent has been made known. As we speak, probably today, there's an open letter that the Financial Times will be publishing regarding a call to action, actually, with respect to timely access to vaccines when they become available. We all know that from the history of infectious diseases that vaccine is ultimately the game changer that will bring us to normalcy and give us the effective, deadly weapon to fight against this virus. But it cannot be a trickle-down process where countries that are wealthier obtain the vaccine first, then Africa struggles with that. I think very early on we have to be sure that the vaccine will be available and accessible and affordable to anyone who is in need of the vaccine. COVID-19, unfortunately, is affecting the whole world. The whole world, which has a population of 7.8 billion people. So it means we have to be very deliberate and build all the partnerships that will ramp up the access to effective vaccines when they become available, and ensure that all 7.8 billion people who need vaccines in the world should the COVID vaccines subsequently should have it. I think that is our position from the continent.
All right. Thank you, Peter, for that question. We have another question coming in from Emmanuel, and Emmanuel essentially is asking about the situation in Tanzania, but you've already taken that. He has a part B. How much of a concern are the testing levels in the majority of African countries? Are there any significant new sources of testing kits that are emerging?
Yes, there are two significant sources of testing kits that are emerging. One is that we currently have a task force in Geneva that is working with several parties, including the World Bank, the Gates Foundation, UNICEF, UNITAID, Africa CDC, to unlock the Global Fund, to unlock that space and make sure that test kits are available to the continent. It's taking time to put that system in place, and you can imagine that this is never a straightforward process, but we are happy that we are beginning to see the light at the end of the tunnel. The second thing is that Africa CDC is aggressively putting in a platform that will allow countries to have access to testing, especially those that are produced by companies in China as well as companies in Europe and elsewhere. So I think we are working on several fronts to unlock the testing front to ease and the testing strategy. It is an integral part of the PAC strategy that we launch that will enable countries to have a predictable access to testing.
The next question is also about testing, and this time it's coming from Peter Mwai of BBC Reality Check. And Peter says, in the past week, we have seen some countries complaining about testing kits and medical consumables. For example, South Africa, which has been conducting many tests, was short of reagents and testing kits and facing backlogs. What would you say is the situation on the continent in terms of kits and consumables availability? Could these challenges affect the easing of lockdown measures?
That's a very good question, and we are fully aware of the situation in South Africa, and of course is related to the aggressive testing strategy they've conducted. And again, it ties to what I just explained earlier, that we as a continental body is working with several partners, relentlessly to make sure that we unlock the testing situation. South Africa has reached out to us. This coming weekend, we will be distributing extra tests, and we're hoping that will unlock the situation. We have 500,000 tests as we speak that is being distributed at the airport now. Ethiopian Airlines will provide us with a distribution information so that by Monday, some of these challenges in many countries will begin to be resolved with the supply that we have standing at the airport and about to be be distributed. With other commodities, it's clearly that the same challenge. We are struggling in context that the whole globe, the whole world is dealing with almost the same set of suppliers. So it's obvious that there will be gaps in commodities besides the diagnostic tests, and we continue to deal with that as the situation evolves. But overall, the access to these commodities and test kits have improved over the last couple of weeks.
We have another journalist who is online, and it's Mohammed Abu. He's the chief correspondent of the African Development Magazine in Accra, Ghana. Mohammed, are you able to talk to us? Hello, Mohammed. Mohammed? All right. Let's move on with questions coming through from WhatsApp. We have a question from Della Russell. In fact, we have a number from Della. Della says, in many countries, including Ghana, the progress of recovery seems to be slow, considering the rate of infection, which is rising each day. What could be accounting for this, and how is the Africa CDC helping member states by way of essential medicines to help in addressing the recovery challenge? So this is the first question. The second one is, what's Africa's vaccine solution, knowing the communities we rely on for essential medicines are also experiencing bigger challenges with the pandemic and therefore are unable to export vaccines to Africa?
So it's in terms of recovery, the low recovery, I'll be honest to say that I've not. We as Africa CDC have not seen the data from Ghana that says that their recovery is low or lower than other countries. But as you bring that to our attention, we will be more than happy to engage with the Ministry of Health of Ghana to understand what is the nature of the issue you are raising there. With respect to essential medicine, remember that PAC, again, which is partnership to accelerate COVID testing, is underpinned by 4 T's. One of those T's is treatment. So we are calling on partnerships to make sure that they have access to treatment or case management of COVID infection, but treatment as a whole, in a holistic way. I mean, if you all remember, one of the pillar of our response strategy is to avoid harm. And harm should include access to ongoing, to treatment, to ongoing endemic diseases like HIV, like malaria, like tuberculosis. We should always remember that during the West African Ebola outbreak, so many people died from Ebola than due to Ebola. So they died from Ebola because Ebola disrupted the flow of essential medication, and not necessarily because they were infected of Ebola. So I think we've got to be very, very sure that in the PAC strategy, we are strongly encouraging the partnerships to ensure a smooth flow of essential medicine, including those that are critical for the vertical programs that I just mentioned. With respect to vaccines, there is really no known vaccine yet against COVID, so I cannot comment as to if countries in the West are exporting or not exporting vaccines to Africa. We don't have a vaccine yet against COVID-19.
Mohammed has come through on WhatsApp. Thank you very much, Mohammed. We couldn't get him on the live chat, but he's written his question down. And the question is, COVID-19 comes as an add-on to already existing impact of climate change on African economies. What mitigatory policy frameworks should African countries be considering?
So that's a very, very good question. I think there's I mean, Africa as a whole is signatory to the agreements that have been reached at the global level. I think it's called the Paris Agreement on climate change and other agreements that have been in place. So the key thing there is that we should, as a continent, be making sure that these agreements that have been met at the global level are actually implemented and follow through with the concepts that and resolutions that we agreed on those. So Africa cannot deal with climate change alone, but Africa has to be catalytic in raising its voice and making sure that those commitments and agreements that have been reached previously are actually met.
Dini says that there is a general outcry that a trial vaccine will be tested in Africa first, and more, how can Africans be assured that the human testing will be safe and Africans will not be made guinea pigs?
Perhaps let me start with the last sentence. I want to assure everybody that Africa would not be a guinea pig. Africans will not be used as guinea pigs. I think Africans have some of the best scientists. Africa has some of the best public health experts in the world, and this is not just being rhetoric. We know that during the West Africa Ebola outbreak, the research that was conducted there for vaccine trials was led by Africans. There's a CDC here, which is extremely competent and solid body, full of top public health experts, which is a resource for every member state to access if they approach concerning issues related to vaccine trials. So we are not longer at independence where we didn't have the capabilities and manpower. We have the infrastructure. We have the capable scientists that have proven that they can conduct life-saving clinical trials in multiple countries. In the Democratic Republic of Congo, scientists like Jacques Muyembe have been instrumental just in the recent past in conducting clinical trials for treatment of Ebola. That became a game changer and is currently a game changer in fighting the current outbreak in the DRC against Ebola outbreak. So conducting vaccines on the continent is not something that Africans are not used to doing, and we stand by all countries to coordinate that effort on behalf of the continent in close collaboration with the World Health Organization, and we will continue to be very vigilant to ensure that two things happen: that any vaccine trial that takes place on the continent is conducted based on the most ethical principles. It's also conducted based on the most scientifically proven principles. And also that there's clarity that there will be subsequent benefit to the continent in participating in these vaccines. Let me just say this, that we Africans don't want to be standby in research against this virus. We want to be fully engaged in the research against this virus in all dimensions, including clinical trials, including vaccines, and including innovative ways of creating diagnostics there. But we have to do that using the same norms and standards that we know and that the world knows and exist publicly through the World Health Organization websites and other websites.
I think we'll take two quick questions because we are quickly running out of time. The first one is from Della Russell, and she says, what has been the progress of work on the Africa CDC's Rapid Response Team, which is supposed to conduct training for trained health personnel across the continent to better manage the pandemic?
That's a very good question, Della. As you recall, when we had this conversation a few weeks ago about the launching of PAC, we, as a critical component to that, was our call to action to deploy 1 million community workers, not necessarily community healthcare workers, but community workers, similar to what South Africa is doing. South Africa has activated about 30,000 community workers. So Africa CDC, as you heard me in my introductory remarks, is beginning to deploy community workers in multiple countries, and we're also in the process of deploying over 60 epidemiologists across multiple countries, especially in West Africa. But the community worker piece is very important. We are building partnerships with the UNAIDS. We're building partnership with the International Federation of Red Cross, and we're building partnership with multiple groups to ensure that we start putting people in the countries, putting community workers that will support contact tracing in the countries as quickly as possible, especially in Cameroon, in Chad. In the coming weeks, these countries, Mali, Togo will already be, Sudan will already be feeling a presence there in terms of deployment of community workers and community healthcare workers.
Thank you so much. Our last question is a follow-up question from Mohammed. And he says, Africa is home to over 5,000 medicinal plants. A few have been scientifically investigated as of today. Does the Africa CDC have a policy framework for supporting the carrying out of scientific investigations to establish the phytochemical and pharmacological properties into more African medicinal plants?
So that's a very good question. As you are all aware, Africa CDC is just 3.5 years old, so we continue to develop those policies, but also mindful that the World Health Organization has developed some of these policies and it suffices to adhere to them. We don't need to reinvent the wheel, but rather to use those policies or enforce those policies that already exist over the and guidance and guidelines that already exist over the years. So I think we are very comfortable that we will continue to work side by side the World Health Organization to reinforce and advocate for some of this guidance.
All right. Thank you very much. That brings us to the end of our press conference for today. It was a pleasure having you online joining us, and also to thank very much Dr. John for always being available to come and answer the questions that are coming from the media. I want just to go out by reminding you of the details on how you can ask your questions to this press conference. So you can do that via Blue Jeans, or you can also send them to our WhatsApp number +251 945 502 310. We are live on air every Thursday at 11 o'clock East African time. For now, it's bye-bye from all of us. We are live on air every Thursday at 11 o'clock East African time. For now, it's bye-bye from all of us.